Okay, we're live. Okay. Hello, 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 and welcome to the Global Youth Mental Health Awareness Show, where we have open conversations with the youth about mental health. I'm your host, KATINDA, author of The Big Comeback and founder of the Confidence and Self-Esteem Academy, and one of GYMHA's special board advisors. Now, in today's show, we are so blessed to be in the presence of 4 amazing panelists. And our first panelist is Brenda Nyokabi. Brenda is a GYMHA Project Support Officer. And hello and welcome to the show, Brenda.
Thank you, KATINDA, for having me. It's good to be here and also to talk to the youth about mental health. Thank you.
It's nice to have you too. Okay, now we have our second panelist is Bukola Abdullahi. Bukola is a GYMHA Ambassador. Hello and welcome to the show, Bukola. Not sure if you can hear me. And we also have a third panelist, is Nabidda Shamim. Nabidda is a GYMHA Project Support Officer and final year student.
It's nice to be on the show this morning. Yes.
Okay, so our fourth panelist is, I was just actually introducing Nabidda. Nabidda, I'll introduce you. So Nabidda is a GYMHA Project Support Officer and final year nursing student. Hello and welcome to the show, Nabidda. And then we have a panelist that is not on yet, Dr. Elizabeth Njani. She is a mental health specialist, research director, and trainer at GYMHA. And when she comes on board, we'll actually welcome her to the show. So in the interest of time, in our conversation today, our guests will give us some insights on substance abuse, the effects of substance abuse, how to support an individual who is using substance abuse, and effective treatment for substance abuse. But before we dive deeper into the show, I would love to know, how are we feeling today? Brenda, how are you feeling today?
Hi, today I'm feeling good. I'm feeling great. I can't complain. The weather is good. Everything is good. So I'm happy to be here, happy to be alive. Yes.
Fantastic, fantastic. Nabidda, how are you feeling today?
Yeah, I'm so good. I'm all right. I'm so delighted to be part of the panelists on this show about substance abuse. And I'm glad to meet you all.
Thank you. Thank you. Welcome to the show. Now, we all know that substance abuse is on the increase, and many of our young people are misusing and abusing alcohol and other drugs that have damaging impact on the individual, their families, and the communities in which they are part of. So then, what really is substance abuse? Brenda, do you want to give us a definition for that?
Okay, yes. For me, substance abuse is the misuse of legal drugs or illegal drugs. And when I talk about legal drugs, I talk about alcohol, nicotine. And when I talk about illegal drugs, I can also talk about marijuana, cocaine, heroin. Yes, that's when you use these drugs to an extreme, that's what substance use is.
Thank you. What about Nabidda? What would you like to add to that? What is, in your understanding, substance abuse? Nabidda, can you hear me? Okay, her screen looks like it's frozen. Okay, we'll just keep moving on because I don't know what's happening there. So Brenda, it looks like it's you and me today. Everybody
no
else,
problem.
the system is not working very well.
Yeah.
So what is the most abused drug?
For me, what I can say, the most abused drug right now is alcohol, because alcohol is so legal. You can buy it. Even people who are underage can buy it. Anyone can buy alcohol. And that's why it's so abused a lot. So we have a really bad drug abuse of alcohol. Also marijuana. I'll say in my country, like here in Kenya, marijuana is also so abused because it can be easily accessed. Like you can just go near the shop, the corner of the shop, you get people who are selling marijuana. So those are the two abuse drugs I can say. Yes.
Right. And is it, you're talking about the alcohol being one of the easiest to abuse.
Yes.
Is that just because people can actually afford it?
I believe so. Yes, it's very cheap because you have this high-end alcohol, then you have this cheap alcohol. So it just caters for everyone. You understand?
Right. So we talking about local brew as well,
Yes.
or
Yes, local brew.
yeah,
Because,
which is what?
because in Kenyan, like you can get for a full cup for 20 shillings. That's like 0.0 something dollar.
Right.
Yeah. Mm.
Wow. Now, Nabidda, can you hear us now, Nabidda? Nabidda.
Yes, I can hear you.
Okay, so Nabidda, I'll just go back to the first question because we lost you there. So what is your understanding of substance abuse?
So the way I understand substance abuse is that when you use any substance which alter the way you function cognitively, socially, and mentally. So the substance, it affects your body systems, the cognitive bit, the social bit, and the mental bit. It can even affect you financially due to addiction. So that's how I understand substance abuse, maladaptive substance.
Right. And in Uganda, because you said you're in Uganda, what's the most abused drug in Uganda?
Am I getting?
Sorry? Go ahead.
The most abused drug is alcohol. Alcohol.
Okay.
Alcohol.
Why do you think that?
Yeah, alcohol
Why do you
is the
think
most
that is?
abused drug in Uganda. I think due to many factories manufacturing alcohol or drinks which have ethanol or which have that alcohol bit, it has made alcohol accessible to most of the people in the population in Uganda, where you find we have the cheap alcohol, we have the expensive one. You find even the poorest person can access alcohol. It makes it the mostly abused substance in Uganda.
Right. Thank you. Thank you for joining us, Bukola. I think we lost you there. Now, Bukola, I just want to ask this question to you as well. So what is your understanding of substance abuse? Bukola,
Hello?
can you hear us? Bukola, can you hear us at all?
Hello, everyone. Can you hear me now?
Yes, we can. So
Hello?
the question was to you now, Bukola. What is your understanding of substance
Yes, I
abuse?
can hear you. I'm responding. Can you hear me?
Yes.
I can hear you. I'm responding. Hello?
Yeah, go ahead. Go ahead.
Hello?
Go ahead. We can hear you.
Yes, my understanding of substance abuse is that substance in the first place is something you take in. Substance use is defined as the use of drug or alcohol. So, can you hear me?
Yes, go ahead.
Okay. Now, substance abuse is when that which you are taking is beyond the prescription that is being given to you, or when it is causing harm to you and to the people that are around you. That is my understanding of substance abuse. When the substance that you are taking is actually causing harm to you, it's affecting your life, it's affecting your productivity, it's affecting your emotions, your feelings, you know it. that this thing is affecting you, but then because there is a kind of because of a feeling that you want to suppress, you continue to engage with that substances. So that is my own understanding of substance abuse. What you are not meant to take first, or perhaps even you are being the drug or the substance is being prescribed to you, but you are taking it in a wrong way, in order that is affecting your health and affecting every other thing.
Yes, thank you, Bukola, for that. But also, Bukola, what is the most
Hello.
abused drug where you are?
Hello.
Yes, go ahead. Bukola, can you hear us? Bukola, can you hear us at all? Okay, I think we'll just keep moving. I'm not sure what's happening there. So, what are some effects of substance abuse? Brenda, would you like to tackle that one?
Okay. What are the effects?
Yeah, what are the effects of substance abuse? What are some of them?
There are so many effects of substance use because we have drug addiction. Someone can go just using drugs once and then you just be drug addicted. It also can cause health problems, like maybe you have a liver failure, you have a heart problem because you're drinking the illicit. It can also cause death, like when you take more of the illegal drug, you can die. Also, when you have substance use, you can also cause it's accidents because your brain is you're impaired, so you can't drive, you can't do anything. And people, when who are really using this substance, they tend to feel like they're heroes and drive. So those are one of the effects I can see of substance use.
Thank you. Nabidda, what do you think? What would you like to add on to that? What are some effects of substance abuse? Nabidda, can you hear me? Nabidda, can you hear me at all? Okay, I'm not sure what's happening there.
Yeah.
Okay. Nabidda, if you can hear me, what are the effects of substance use or abuse?
Sorry?
So, what are the effects of substance use or abuse? Okay, I think we've just lost her. So now, if you just joined us, we're talking about substance use, the effects of substance abuse, how to support an individual who is using substance abuse, and the effective treatment of substance abuse. So please click, share, comment, invite your friends to watch and ask questions, because this is a very critical subject, especially it's affecting our young people, and we need to really inform them, empower them, and help them, also support them to seek help, because substance abuse is really not good for your health. Now, I see here we have a comment from Fulfill Repent. The topic of today is a serious challenge in our society now. Please, how can we tackle the problem effectively?
Yeah.
Brenda, what would you like to answer to that, to Fulfill's question?
As I said, it's a serious challenge in our society. So, what we can really do, one of it is advocate for telling people about what substance use is. Because, okay, like I'll say in movies tend to glorify drinking. You'll find every movie has a scene of people drinking. At night, you'll find women, this series of women. Every woman at night, after a long day of work, is going to drink wine. You see, so people don't understand the long-term effects of drinking or even using drugs. Like now, right now, if you people hype cocaine, cocaine is very addictive. In maybe like after 2 uses, you're addicted to it. So does also other like heroin, opioids, prescribed medicine. So we really need to advocate and stop glorifying substance use. Yes.
Thank you. Nabidda, you're back on. So the question was, what effects of what do you think you would tell us about the effects of substance abuse and substance use? I don't know. If you can hear me, please let me know.
Yes.
Go ahead.
Yeah. Substance use has very many. Yes, I can hear you. Let me know if you can hear me.
Yes, we can.
Are you able to hear me?
Yes, yes.
Okay. So substance use has a lot of effects. Brenda has talked about the effect to health. You find the use of alcohol can lead to psychosis, mental disorder. Use of alcohol can lead to gastritis. That's why you find that people who are taking alcohol wasted because there is a way it affects their absorption of food. They can end up having hypertension, high blood pressure, and stroke. On top of that, they can end up being depressed due to addiction. When they become addicted and very dependent to alcohol, they can't live without it. So as they try to withdraw from the alcohol, they end up getting depressed or the depression disorder. Some people find themselves they need to be admitted in order to let go of alcohol. So when someone can't afford money due to addiction and one day he misses out alcohol and can't get money, they end up being depressed. That's how depression comes about, and psychosis and schizophrenia, hallucinations. So substance abuse comes with a lot of side effects in the aspect of health. And then we have economically. Economically, these people, when they get addicted to alcohol, I had a scenario in the psychiatric hospital when the guy was left with the money for the family, but had sold all the land which was left with him just to buy alcohol. So the mother had done everything to ensure that they
Okay, well, look like we've lost
Okay.
a bit again.
Yeah.
I see here we've got another question from Phil. He says, please, how can we handle and tackle the problem effectively? Now, we're about to talk about that. The next question is, Brenda, how do we help someone with substance abuse?
Okay. First of all, I'll say every treatment is different from everyone. You cannot this what will work for one person isn't going to work for the same person. Okay. But what are the treatments? One of it I can say is to see a doctor about it. Don't be scared. Don't be stigmatized that you'll be people will face you, people will look at you badly. No, and once you see a doctor, now then you can start counseling, or you can also see a psychiatrist. Another way I can say is CBT, which is cognitive behavior analysis or treatment, where people see and look at how you're behaving when using the substance when you're using the substance. Sorry. Another one I can say is rehab. It reaches an extent where you can't help yourself, but with rehab the doctors will help you, and they'll also get to know what your problem is and guide you. So those are the effective treatment I can say of substance use.
Thank you. I see, Nabidda, you're back. So, Nabidda, we're just asking, how do you help someone with substance abuse? Brenda has mentioned a few, seeing a psychiatrist, seeking help from a doctor. What are your thoughts? Nabidda? Not sure. Nabidda, can you hear us? Can't hear you. Okay, go ahead.
Thank you so much. I'm sorry. I'm sorry. Yes, I can hear you. Are you able to hear me?
Yes.
Are you able to hear me?
Yes, we can.
Oh,
Go ahead.
okay. So, yeah. I'm so sorry. My network is a bit bad. The effects of substance abuse are so many. Let me first continue the economic bit. When people get addicted, they can spend every coin in their pockets just to buy the substance when they become addicted. So they cannot care for their family. Some can end up losing their work because they are not functioning well mentally. They can lose their job opportunities. That's how mentally it affects. Substance abuse can lead to lung cancer, and substance abuse can lead to liver disease.
Okay, I see here we have a message, we have a comment from Alicia Nwako. This is an important topic in discourse. The use and abuse of substance is one thing that is at a very high rate and thus calls for the kind of exposition. Thank you, KATINDA. Yes, thank you so much, Alicia, for that comment. Yeah, we know, I mean, this is a very serious topic, especially when it comes to the young people. I think a lot of people, and especially this time during COVID, I think it's probably made the situation worse because a lot of people are idle, they don't have something to do. And what else can they do to just pass time? And most people just happen to start doing this. Maybe they're already abusing alcohol, but not maybe going to another extent because of the fact that they're depressed, they're locked down, they can't go places, they can't work. Yeah. So Nabidda, I see you back. If you can hear me, you can continue.
Yeah. How can we help people who are abusing substances? First of all, we have to ask ourselves, why are these people abusing alcohol? You find most people are stressed and they don't have any other option. They don't have people to listen to them. You find some people are just idle. You find some people are just peer pressure. Sometimes you go out with friends and they force you, they be like, at least take a sip of alcohol. They want you to get used. So when you find out why are these people abusing alcohol, first they need people to listen to them. So they need a counselor. They need to be counseled. When you realize someone is stressed, is taking alcohol. Someone told me was checked by the girlfriend and decided to go to the bar, and that's how it is started to take a lot of alcohol, and now can't miss a week without taking alcohol. So it has caused addiction. So if we could hear out these people, why are they doing these drugs, then we can get a way of helping them. Even in hospitals, they can help you to withdraw from alcohol. There are some medications they can help you with to help you withdraw. But most times they first find out, why are you doing the drugs? Because if you don't accept that you are abusing drugs, there is no way you can be helped. Someone can be given medication and they throw them away. They can be guided on the way of withdrawing, and they don't take the guidance, because there is that good feeling they feel. There's that good feeling which comes when they use the drugs. So there's no way you can help them if they don't accept that they are abusing drugs. And another thing, community, we need to find a way of engaging people so that they don't be idle. The more people be idle and they don't have nothing to do, that's how they end up abusing drugs. So if we get things to engage the young ones in, we get counselors, we get accessible numbers for management of stress, and other things which can depress people, so that they cannot resort to abusing alcohol and other drugs to get comfort. Then maybe we can help those people who are abusing substances. That's my submission.
Yeah, I like what you said about engaging the community, but also I think maybe the community can come up with projects that these young people can be engaged in, because just helping them and talking about it is one thing, but getting them actively involved in something that is purposeful, something that's meaningful, something that makes them feel wanted, important, and all these kind of things. So I think that's a very critical thing too. And I see we've got Dr. Elizabeth Njani. Hello and welcome to the show. Hello, Dr. Elizabeth. Okay, she's frozen. Hello, Dr. Elizabeth.
Hello, how are you?
We're doing, yes. Welcome to the show. Okay, I don't know. Can you hear us?
Looks like I am hanging somewhere. I can't even hear you people. I can't hear you well.
Are you in a quiet place? Somewhere you... I see we have a comment here from Jennifer Wangari. Thank you so much for, yes, joining from Nairobi. Well done for the great work that you're doing. Thank you so much, Jennifer Wangari Wayaki. We're here to serve, and that's why we do shows like this. This is a show to empower young people, to empower the community, empower everybody, so we can all work together to make a better life for everybody. So, Dr. Elizabeth, can you hear me at all? I'm not sure if she can hear us at all. Dr. Elizabeth, can you hear us at all? We can't hear you. Okay, I think we're having some technical issues today. So, Brenda, I'm just, again, going to ask this question. So what are some effective treatments for drug abuse? You mentioned before, we're talking about how do you help people, by going to a doctor, going to a psychiatrist and all those kind of things. But there's also so many other things. What are your suggestions?
Okay, another thing that I can suggest is evaluation. Like we can continue evaluate. Like let's say someone has gone to hospital, we can continue evaluating them in short term and in long term. In that, the way Shamim had said, that you need to check up on people if they're taking their medicine, how they're feeling, what is happening in their lives. Because you see, someone who maybe after seeing a doctor, meaning from seeing a doctor, then goes back to home, they'll be like, now I'm okay. Then they will be like, drugs are fine now. But you see, the reason why someone went to this depressive episode so that they can use substance was maybe because of depression, anxiety, other diseases. So I can say evaluation of that person in a short term and a long time way. Yeah, thank you.
Thank you. Dr. Elizabeth, if you can hear us, we're talking about how to help someone with the substance abuse and what are the effective treatments for drug abuse.
I hope you are dealing with how to help someone with a substance use problem. And I would say this is not something that we do as a reactive kind of activity. Focus at all the interventions that can be availed to this person, from prevention to treatment to integration within the community. And when we talk about the prevention, we are looking at how can this person be trained with life skills so that skills are cut across from those ones that focus on children to the ones for adults. Then there is what we call the preventive drug education, and there is also the parenting skills. And here you target the parents so that they can deal with the young ones, where you are looking at your role as a person to provide.
Okay, we're kind of
Guidance.
losing you there.
You'd
Yes.
call early identification for the.
Okay, thank you. Thank you. And Bukola, thank you for joining us back again. We're talking about how to help someone with substance abuse and the effective treatment.
I'm saying we need to do early identification of substance use among the children and youth, but your support. I'm not.
Okay, you're breaking out, Dr. Elizabeth. We can't hear you properly.
I don't know what has happened today with the connectivity. Have changed the
Yes.
gadgets. I hope the last one I was talking about is earlier.
Okay. The system today is not very favorable. Bukola, what would you like? If you can hear
Yes,
us, what is your take
yes,
on that?
I
How
can
do you
hear you.
help someone? Yes. How can you help someone with substance abuse and effective treatments for drug abuse?
Okay, can you hear me?
Yes, I can.
Okay, I think the first thing is many a times we wage war against the substance use of the individual, but there is always an underlying factor that may have made the person to actually be engaging substance use in an abusive way, and that is trauma. So the first thing in helping somebody that is abusing substances, either drugs or alcohol or any other substances that we can mention of, we firstly need to understand the underlying factor that brings about that decision of theirs to go into substance abuse, and that is trauma. We need to understand it perfectly. So when we now have a better understanding of the trauma, and the way we can know this is by we engaging the individual in conversation, getting to know, okay, what problem are you going through or what challenge are you going through? When the person is able to explain the trauma to us, I think I just concluded the PFA um, sponsorship class from GYMHA, and we're being taught how we can actually engage people, in conversation, which requires listening, which requires you being empathetic. So with all of this approach, we will be able to get the trauma experiences. Now, when we now get to the trauma experiences, we should now begin to now look for a way to curb their decisions on the trauma experiences they are going through. And one of the things that I would suggest is that number one is the person needs awareness. The person needs to know that he or she is not alone in this. When this person feel loved, when this person feel cared, the person will be able to know that, okay, I am not the only one in this. I am being accepted. Because number one thing that makes people to go into abuse of substances is when they are being denied, when they are being rejected. So the first thing is to show this individual or the group of people is we should show them love. Through that, we can now begin to sensitize them on the consequences of the substance they are using that is being harmful to them. Then another approach that I think we can engage is that we need to also refer them to a professional. They need to go through a professional help. And this way, many a times they don't want to go through professional help because they feel they will be stigmatized. But this is where we also need to assure them that don't worry, we are with you. And the person that we will be connecting with you, either a doctor, a therapist, that is going to handle you, is somebody that has gone through the training and that knows what is expected of him or her to do. So there won't be any negative judgment or negative perception of you. So with that, I believe this person will be able to go through the medical or the professional help that is being needed. Then another thing is that these people also need to be engaged in some activities such as mindfulness, whereby they begin to have a thinking, a right perspective towards whatever challenge they are going through and towards the substance use. Because when a person comes to an understanding that, oh, this thing that I'm using, this substance that I'm using, perhaps it's not causing an immediate effect, an immediate consequence now, but it can cause a future consequence. With that, the person will be able to make a right decision, in helping them to overcome that struggle. Another thing that I would suggest is that we can engage such people in volunteering, opportunities. When someone is going through a struggle of substance abuse and you want to help the person, the thing you can recommend is that, okay, why not try to seek to help others that are going through this struggle? In the place of you trying to help others going through the struggle that you are going through, there is a place of you building up. There's a place of you acquiring knowledge in order to help others. So, in such a place, you will be helping yourself as an individual, because by the time you are getting resources in order to help others, you will firstly discover that, oh, I think I personally need these resources first. And it will be used on you when you are now using it. It is then that you can now say, okay, let me now give on to others. Let me help others that are going through the struggle. And another effective way is that such people need to be taken to environment, a serene environment, an engaging environment where they can explore, so many things that can help them to build motivation. We can organize film shows, we can organize sport activities, you can organize, things that will not make such people to be bored, to stand alone, things that are engaging, that can, like educational things or recreational things that are engaging, that will not make such people to think of, okay, I want to go back to my substance use. These and many others that I feel it can help people in overcoming substance abuse challenges.
I know, Bukola, you've given so many suggestions there. I know, though, you're not alone. That's the one thing I find a lot of people, sometimes when they're in a bad space, they always think they're the only ones in that space. But normally the truth is somebody else has got a similar experience. But the truth is you are not alone. There is help out there. Speak to somebody, speak to a therapist, speak to your doctor, speak to a family member you trust, find a friend that you can trust. Because like you said, when people feel rejected, when they don't feel they matter, when they feel they're not loved, that is a consequence of what? You feel alone. And once you feel alone, the next thing is to try to cover that neglect, whatever that feeling is, that loneliness or that emptiness. And obviously substance abuse seems to be really quick to cover the problem, but then it's a temporary problem. It doesn't fix anything. It actually just makes it worse, because once you get addicted, now we've got a different, bigger issue. Now I see here we've got Elisha Nwako. He says, thank you, Abdullah Bukola. The fear of being stigmatized is one key factor that deviates people's interest. That is very true. There's a lot of stigma around everything mental health. And that's why I think we're doing this show, so we can encourage, we can tell people, look, we are here to help you, but don't feel afraid. Just seek help if you need it, because the faster you get help, the better it is for you, and the better you can get back to your normal life without all the pressure or the stress or the negativity around the people too, because other people see you do this substance, probably they don't want to associate with you. Then you get isolated. That also doesn't help. Now, but there's one thing here I just want to wonder. So, Bukola, you said that you did the psychological first aid course or program, but how do you, as a friend
Yes.
or a family member, influence someone who is abusing substance, like to seek help? Because really, you're talking about we need to do this, we need to, but what is the tactic? What is the steps of, let's say you have a sister, a brother, a friend who's actually abusing alcohol, and you know people when they're doing it, they're very difficult. So it's basically, what language do you use to persuade them to seek help? What are the steps?
Okay. One of the things, because I do engage with youth, I on the streets, with destitute children. Sorry, I used the word. And then the first thing that I think I do is, most times I don't make them to. I don't use professional words in describing their situation. For instance, I don't tell somebody you are an addict. I don't use that kind of word. The first thing that I do is I address them as friends. I mean, I'll even make a proposal of friendship to you, and I'll tell you that what I'm coming to do is, I just want to be a friend that you can talk to, a friend that you can share things with, and from there I use a friendly communication. And number one thing that I said is, we should not use the word addiction, that, oh, you are addicted to substances like this or something. No. That word carries, it makes them feel bad. It makes them feel condemned. But when you tell them that, oh, I this thing that you are using, I believe there is a reason for it. You make them to see that, okay, you are thinking in the line of their thought. And another thing is that I make them feel welcomed. I make them to, share. Just share if you care to share. But with that, when they are sharing, what I do is I try to listen. Tell me your story. Most times I even shared my own story at first. That, oh, I might have gone through this before. And in order for you to know that you are safe, can I share my story with you and how I am being able to overcome it? So by the time you are able to share your story with them, they get to understand that, okay, now this person I can talk to, because you can share in their pain, you can share in their struggle. Then another thing that I do is, most times when I want to talk to those people, when I want to approach them, there are times I go with gifts. I present gifts, whatever gift that I know, because many of them that are taking these substances, many of them feel hungry. Many of them are tattered. They don't have clothes to put on. So when I am approaching, I would have observed them carefully and take a look. Okay, what could be the basic need of this person? Now, when I've been able to identify the basic needs of this person, then I go with that basic need. If it's someone that I know that, oh, this person is into drug and he has not been eating very well, I will go there with food, or I ask the person, can you go with me to our eatery so that we eat together? That will facilitate our communication. So providing a friendly environment actually is the key to you approaching, this set of people. And thereafter is that I make sure that I keep them engaged. I don't lose them, for whatever reason. Perhaps if I'm seeing that somebody is withdrawing, it is fine to withdraw. It is not always easy to cope with that struggle, because there are times whereby they feel like, oh no, you can't be a friend of mine. They have that kind of feeling. But most times I reach out to them and I said, oh, I understand that you may want to withdraw, but at this stage where you are, know that I am there for you. So the communication approaches is just a friendly one that needs to be engaged. Thank you.
Thank you so much. Did anyone want to add anything before we conclude today?
Yeah.
Go for it.
Yeah, on addition to his submission, creating a friendly environment, you have to help them brainstorm how this substance abuse has affected their lives. So by ensuring confidentiality and privacy, together with a friendly environment. Help them brainstorm how substance abuse has affected them mentally, physically, or with their occupation or opportunities they are working on. So when you help them brainstorm, they will look into it and realize it is a problem to their lives, or there is a way it is affecting the progress in their lives. When you help them after knowing how substance abuse is affecting them, they will accept the problem. For me, I think substance abuse is we can help them by letting them know, or by guiding them, or by ensuring they know how substance abuse is affecting them. If they are unable to realize that substance abuse is affecting them, it will be hard for them to comply to the medication or any intervention you will bring on board to help them. So friendly environment, and even them accepting that they are abusing the substance and it is affecting their lives. That's what I think. Thank you.
Thank you. Now, just on conclusion, what is one thing we can all, what's one thing after anyone watches this show today? What is the one action they need to take immediately to either help a friend who's abusing substance, or even if they're the person who's abusing substance, what is the one thing you can tell them, or message you can give them? What's the one action they can take straight away from if they watch this show? Brenda, what's your take? You're muted. Brenda, you're muted.
So sorry about that.
That's
Okay,
okay.
the one thing I can tell anyone who is has substance abuse, you're not alone. Definitely, you're not alone. Yes.
Thank you. Abdullah Bukola, what's one message you can, or one action people can take after watching this show today? Bukola, can you hear me?
Okay. All right. For people that are in this struggle of substance abuse, my message for them is they should make a decision to change. Yes, it's not always easy, but they should make a decision to change. And when they are making decision to change, they should also prepare for the change. And when they are preparing for the change means you dealing away with your triggers, you know, whatever that can spoil you to go back, you know. And then another thing is they should not give up. Healing is not a one time thing. There's tendency for you to rise and fall, but don't give up on yourself. Continue to rise as much as possible. If it's going to take you 100 times to take a step to overcome that battle, it's worth it, because it will be part of the greater testimony that you'll be sharing. And one thing that they need to know is that overcoming the struggle can also be a guide for someone else that is going through that struggle. Now, I want to also talk to people that have this, you know, class of people around us. One thing is, do not pass judgment. You may not know what somebody is going through that is making somebody, to rely on substance use. Do not judge. Be empathetic. That's the word. Be empathetic. When you see somebody that is abusing substances, just try and put yourself in their shoe, that there is possibility that they are going through a struggle. And a kind word can actually uplift a dying soul. A kind word. So we should learn how to speak positive words, kind words to these people, and we should be able to ready to provide them help. We should make them to be assured that it is not about what you think about them. It is about what who they are right away and how you want to help them. So if there are things available, if there are resources available, don't hide it. Sometimes it may require us to invite somebody to your house and say, "Don't worry, I want to sponsor your education. Oh, I want you to learn a skill that can keep you busy. I want to withdraw you from your friends. It's only takes a simple gentleness, a simple approach, a kind gesture, to uplift a dying soul. So we should not neglect these classes of people. We should not abuse them because many of the things I've seen around, from my own experiences, is that the, even the security sectors are not helping. They just come, they just arrest them anyhow, put them into prison. But what is most important is that people should be able to provide a holistic approach, in helping them. The one last thing that I would say is, if at all there is no resources that you can offer someone, I think you can pray because in GYMHA we have spiritual care, so you can pray for that individual and that individual can actually recover. Thank you.
Thank you so much. Yeah, they say, it's always very careful. The language you use with people who are abusing substance is very critical. And usually I know I say, if your words don't bless someone, and if you're not praying for them, and if you're not empowering them, then don't do anything. It's better to do nothing than to actually disempower people. So, Nabidda, what's up? What about you? What's the one message?
Yeah, the message which I would like to give to everyone: please don't stigmatize people who are abusing substances. They have a reason why they are doing so. Instead, give them a listening ear. So listen to them and talk to them. Another thing, if you can't help them, kindly refer them to someone who can help them. And to all people who are abusing substances, it's not a one-time thing to withdraw, but it takes some time. But when you really need to withdraw, one time you will be able to withdraw, though it will not be an easy process.
It's willpower. Yes, willpower. It takes a long time. So just before we finalize the show, you can find information on the Global Youth Mental Health Awareness by visiting our website, www.globalyouthmentalhealthawareness.org, or you can email jude@gymha.org. And before we leave, where can people find you? If people want to get some more information about yourselves, if they need to seek help from you, are you on social media? Where are you? What names? Can you just quickly just tell us one place they can find you and what name? Brenda.
Okay. Hi, everyone. My name is Brenda Nyokabi. I'm a mental health advocate in Kenya. You can find me on my Instagram page. It's called Kenya Evolving in Mental Health, which is called K-Evolve. Thank you, Katinda.
Thank you. Bukola, where can people find you?
Okay. I am Bukola Abdullahi. So, a mental advocate here in Nigeria. They can find me on Facebook by my name, Bukola Abdullahi, and I do respond to messages a lot.
Thank you. What about Nabidda? Where can people find you?
Yeah, I'm called Nabidda Shamim. I'm not only a nursing student in my final year, I'm also a peer educator. So I love empowering, inspiring, and teaching my fellow youth any knowledge I know. So you can find me on Facebook, Mutebi Shamim, Mutebi, and then Shamim. Even on Twitter, Mutebi Shamim, Instagram, Mutebi Shamim, on LinkedIn, Shamim Nabidda. Thank you.
Thank you. You can actually put all those details on the Facebook so people can actually find it easily without them having to stress. So just put so they can just click it if they really want to get in touch with you. So thank you so much, Bukola, Brenda, Nabidda, and Dr. Njani, for sharing your insights on substance abuse, the effects of substance abuse, how to support an individual who's using substance abuse, and effective treatment for substance abuse. I want to thank you, viewers, for being a fabulous audience, and for watching the Global Youth Mental Health Awareness Show. Until next time, may you all experience the frequencies of love and light. Stay safe and stay blessed. Bye for now.
Thank you, Katinda, for hosting us.
Thank you for being in the show.
Yeah, we always have to appreciate the host. So thank you, Katinda. You really did a good job.